I was invited to speak before a medical class a decade ago, and a few students asked me these questions. What's the difference between dementia and Alzheimer's disease? Are they the same? Can these conditions be reversed? No, and not reversible, was my answer for true dementia damage. But for dementia-like symptoms caused by underlying conditions like depression and vitamin deficiencies, the condition is reversible. As defined by the National Institute of Aging, dementia is an irreversible decline in cognitive function, such as memory, thinking, or reasoning, significant enough to interfere with independent daily living. On the other hand, Alzheimer's is degenerative brain disease caused by complex brain changes, plaques and tangles, that lead to cell damage. And this is the most common cause of dementia, accounting for 60 to 80% of cases. Having differentiated the two conditions, we can now discuss how to reduce or prevent the risk of these issues. Recognizing the signs of dementia and Alzheimer's is crucial for enabling timely intervention, implementing lifestyle changes, alleviating caregiver burden, and enhancing the individual's quality of life. Here are the key prevention strategies. Lifestyle choices. 1. You need to stop smoking. Smoking increases dementia risk by roughly 30% to 40% because its toxins damage blood vessels, restrict blood flow to the brain, and cause inflammation. It accelerates brain atrophy, shrinking, specifically affecting memory-related areas like the hippocampus, while creating oxidative stress that damages neurons. Quitting smoking can, however, reduce this risk to that of a non-smoker over time. The Johns Hopkins University's Bloomberg School of Public Health in Baltimore found out that smokers' increased risk for dementia decreased over time when they quit. 2. You must manage alcohol intake. Alcohol intake increases the risk of dementia through direct toxicity to brain cells, causing structural brain damage, accelerating shrinkage, and inducing chronic inflammation. Long-term or heavy drinking causes nutrient deficiencies, thiamine, and damages blood vessels, leading to vascular dementia and increased tau protein buildup. 3. It is important to protect your head. Head injuries, particularly moderate to severe or repeated traumatic brain injuries, TBI, increase dementia risk by triggering long-term neurodegeneration, causing abnormal protein accumulation, tau and amyloid, and inducing chronic neuroinflammation. These injuries damage brain cells, disrupt nerve communication, and may accelerate brain aging. Research from Alzheimer's Research UK stated that almost half of dementia cases worldwide could be prevented or delayed. If nobody experienced a severe head injury, there'd be 3 fewer cases of dementia for every 100 people who develop it now. 4. You must manage sensory loss. Managing sensory loss, particularly hearing and vision, is linked to a higher risk of dementia because uncorrected sensory impairment causes structural brain changes, increases cognitive load, and promotes social isolation, all of which accelerate cognitive decline. While it is not always a direct single-cause relationship, the inability to process sensory input effectively puts strain on the brain that can hasten dementia. 5. It is crucial to get quality sleep. Prioritize 7 to 9 hours of sleep nightly. Research indicates that sleep deprivation is a significant risk factor for dementia, particularly Alzheimer's disease, because it disrupts critical biological housekeeping processes required for brain health. The Harvard Medical School has narrated that if you don't get enough sleep, your brain won't have enough time to drain away beta amyloid, a protein fragment forming sticky plaques that are primary hallmark of Alzheimer's disease. These substances then continue to accumulate, day after day, until they cause dementia. 6. It is must to engage in physical activity. Engage in regular aerobic and strength-building exercises to increase blood oxygen flow to the brain and maintain a healthy weight. Physical inactivity contributes to dementia by reducing essential blood flow to the brain, accelerating cognitive decline, and promoting vascular risk factors like high blood pressure, diabetes, and obesity. Lack of movement reduces brain-derived neurotrophic factor, BDNF, a protein crucial for neuron survival and growth, and can cause shrinkage in brain regions responsible for memory. 7. It is necessary to have a heart-healthy diet. A heart-healthy diet supports brain health by protecting the blood vessels that supply the brain with oxygen and nutrients. Consume diets rich in fruits, vegetables, whole grains, and fish, Example, Mediterranean diet or MIND diet, while limiting processed foods, salt, and sugar. 8. You must manage your conditions. Uncontrolled high blood pressure and high cholesterol levels causes dementia by damaging, narrowing, and stiffening the brain's blood vessels, reducing essential oxygen and nutrient delivery to brain cells. 9. B. Stay socially and mentally active. Not staying socially active increases dementia risk by causing lower brain volume, reducing cognitive reserve, and driving unhealthy lifestyles. Social isolation induces chronic stress, depression, and poor cardiovascular health, which directly accelerate cognitive decline. Conversely, social interaction strengthens neural networks and uses the brain to fight atrophy. The Alzheimer's Society of UK has indicated that lonely people are more likely to drink heavily, smoke, not exercise, and be overweight, and have heart problems, all of which increase dementia risk. 10. Vaccines and prevention is a necessity. Vaccines are linked to a reduced risk of dementia, primarily by lowering chronic inflammation and strengthening the immune system's resilience. Emerging research suggests that common adult vaccinations, such as those for shingles and the flu, may lower the risk of developing dementia by 20% to 50%. Now that we have discussed how to reduce the risk of Alzheimer's disease and dementia, the question is, when is the proper time to act? While it is never too late, adopting these behaviors in midlife, aged 40 to 65, is most effective for long-term risk reduction. In conclusion, preventing dementia and Alzheimer's involves adopting a healthy lifestyle that promotes brain health, primarily focusing on cardiovascular health, diet, physical activity, and social engagement. Key strategies include exercising regularly, eating a balanced diet, managing blood pressure and diabetes, quitting smoking, and staying socially active. On a final note, there is no cure for dementia yet, but there are lots of support that help you live as well as possible. Getting a diagnosis should let you know what type of dementia you are having. It can help you plan for the future and access therapies and support groups. So, if you learned something new today, hit the like button and share with a friend. If you're new here, consider subscribing if you like to join our community. Watch the video that comes up on the screen. YouTube thinks you'll love it. Thanks for watching. We'll see you soon.